Dr. Quick, it is no surprise to you that without a vaccine, pandemics continue. How long is the Jonathan Quick continue without a vaccine?
Uh, well, I mean, we need to continue to practice those basic personal protective habits that that have not only flattened the curve but bent it to near zero in countries, and that's going to be, I mean, for the foreseeable future. I mean, but we will. I'm confident we will have a vaccine, but that's going to be into next year, and it's going to take several years to get global coverage with a vaccine. So in the meantime, those basic habits of masking, distancing, hand washing, crowd avoidance, I mean, those are habits that will keep us safe.
Jonathan Quick, with your work at Rochester and Strong Memorial years ago, you knew Gordon Douglas, the giant of Merck, and the people that were working on bacteriology, virology, and such, and the cures, the vaccines. Do we completely underestimate as amateurs the complexity of the process to make a vaccine?
Well, I think the end-to-end process of a good idea for a vaccine, and a vaccine that's proven safe, effective, and is in large-scale production, that's a complex process. That said, it's a process we know, and it's a process for which we're now seeing historic innovation. I mean, we have never had a situation. We have 40 vaccines now in human testing. We've got a dozen of those that are in the latter stages. To do that in a period of 8 months is stunning. I mean, unimaginable even a few years ago. So I think that we're just seeing technology advances, and I think with the number of vaccines in testing, we will have. I'm confident we will have at least a couple, if not more, that will prove safe and effective.
In the meantime, Dr. Quick, Prime Minister Boris Johnson coming out and saying that he recommends people work from home through March 2021. Some people surprised that it's that far out in the future. Is this the new reality, though, that really cities around the world need to be facing?
Well, they need to be prepared for it. The key thing is, UK has they were a little bit slow at the beginning, and they've had a challenge containing it, but they're 3 times the level of countries like Italy, Germany, Sweden. So we know that you can, if you really get at it, and the population is following the personal protective guidance, you can tamp down that level of viral spread. We've done it in this country, in state after state. New Jersey, Oregon, New York, Maine, they've all kept the levels down. So I think that, yes, we're facing those sorts of more severe, stringent measures if people won't follow those basic protective habits.
Dr. Quick, why don't we have better testing that can actually give us results quickly and that we can distribute in mass?
So the trajectory there is stunning. I mean, it took a while to get going. For the first 8 months, we've been relying on the lab-based testing here in the U.S., which is a cumbersome process of sample to lab and back and all the shortages. We're on the cusp of a dramatic takeoff in testing. So we now have a half a dozen rapid antigen tests on the market. We're seeing that they're getting more convenient, more affordable, now down to $5, and much more accurate. We at Rockefeller have mapped 6 or 8 of the producers, and they have the capacity by January to be producing 200 million tests a month. So we have that there, but we have to commit the resources.
Right.
We've got to get the federal and state commitments to actually purchase those tests. And we're seeing that now. We're working with 10 states that have made a commitment for 5 million test purchase. But we again, technology is advancing quickly. we've got to provide the resources and help states and the federal government understand what needs to be done.